Can you hear me, Nadine? Hello.
Her screen seems to be frozen.
Nadine, can you hear me?
Yes, can you hear me too?
Yeah, I can hear you.
Okay, that sounds great.
Can we start?
Sure.
Okay.
Okay.
Let me start with introduction of your background, Nadine.
Okay.
Okay. Good morning, everyone. Thanks for connecting on day 4 of the Nursing and Pediatrics webinar, and thank you everyone for connecting here. Okay, before going into the talks, let me introduce our moderator, Nadine Zayed Zinab is an oncology pharmacy unit manager, pain and palliative pharmacist, ethics and research committee member, and medication of safety group member at Clemenceau Medical Center, affiliated with John Hopkins Medicine International, with 7 years of experience in oncology pharmacy practice. She is an active member at the European Society of Oncology Pharmacy and a part of educational board at the European Specialization in Oncology Pharmacy. She completed the following certificates: clinical pharmacy virtual internship course at Children Cancer Hospital Egypt, ASHP pain management certificate, ASMP, ISMP medication certificates, safety certificate, ASHP clinical skills for international pharmacist, and masterclass certificate, pharmacy services on cytotoxic drug preparation and safe handling, clinical oncology pharmacy service, completed her MS in pharmacology and therapeutics at the American University of Beirut by 2013, and a BS in pharmacy at Lebanese International University by 2009. Thank you, Nadine. Over to you.
Thank you, Mr. Krishna, for this wonderful introduction. And hello again. Welcome to the 4th day of the Pediatric and Nursing webinar. Hope today is going to be fruitful, and also we enjoyed as it has been the last webinars, the couple of last days. So with pleasure, I would like to introduce Dr. Aline Nassar. Dr. Aline Nassar, an established executive, specialized in organizational excellence and capacity building. Her expertise and proficiency in analyzing and understanding the foresight of organizations and translating it into insights to build organizational capacity and advance performance have been a differentiator. So it's a long and interesting, actually, biography to read. So Dr. Aline has a sound track record in driving organizational transformation through exploiting her expertise as a leadership and a licensed emotional intelligence. Over the past 20 years, Dr. Aline has been instrumental in substantiating strategic growth and transforming underperforming organizations, as well as enhancing the efficiency of the productive ones. She had the opportunity to work with organizations around the world, in the United States of America, Germany, Lebanon, United Arab Emirates, Kingdom of Saudi Arabia, Kuwait, Bahrain, Qatar, Oman, and Egypt, all of which enforce her expertise in international systems and multicultural leadership environments. During her 20-year service as a senior healthcare executive and in appreciation to her accomplishments, Dr. Aline achieved 25 awards from various sectors: governmental, regulatory bodies, public, and private. She was namely recognized by the UAE Nursing and Midwifery Council for co-founding the council in 2010. In addition to that, Dr. Aline received awards for successful organizational capacity building, her skilled leadership, advancement of leadership teams, and enhancement of service quality. Dr. Aline organized, chaired, directed, and served as a faculty on more than 60 international conferences. So she has several publications on leadership and capacity building, and is an an editorial board member at the Open Access Journal of Clinical Surgery. Dr. Aline holds a doctorate degree in educational administration, a master's in psychology of education, and a bachelor's degree in nursing. Throughout her career, Dr. Aline has served as a CEO, executive director of health affairs, executive consultant and advisor, corporate chief nursing officer, and the chief quality officer. So let's all welcome Dr. Aline. Dr. Aline would be presenting her talk on effective nursing leadership, transforming toxic work environments. Thank you, Dr. Aline, for joining us. We're looking forward to it.
Thank you, Confrontiers Conferences, and thank you, Nadine, for reading out the whole biography. It's humbling to be with you, and I'm very excited to discussing my upcoming talk on effective nursing leadership, transforming toxic work environment. So I think I will not need the half an hour, but let's see how we go. And please, if you have questions or comments, feel free to just stop me at any point. I like interaction. So leadership, as we all know, is classified as a skill. It's not a position. So despite the number of years of leadership experience we have, what we need to focus on is that each situation and each team requires a different set of leadership skills to address and handle. Leaders need to be capable of adjusting their leadership styles based on situations and teams they lead. So we need, as leaders, to be flexible if we want to be effective. So leaders are effective when they are influential. And what does that mean? That's based on what they do. That is based on the productivity, on the actions they take, on the influence they have, and the outcomes of their leadership. As we all know, effective leadership is something that everybody would want to be an effective leader. But effective leaders and influential leaders need to be capable of empowering their team, potently communicating with them, supporting them, stimulating their interests, and developing their potentials, empowering them again, and motivating them. But most importantly, effective leaders need to be capable of being in control of the work environment. And when that work environment becomes toxic, to address it and eliminate it as needed. As healthcare leaders, we want to boost the work environment to make it comfortable for our team and for the patients and their families. So there is an inversely proportional relationship between work environment optimization and negativity. So the more negativity, the more difficult for us as healthcare leaders to boost the work environment, and the tougher it is for professionals to perform at their best. Leading in healthcare is not easy. It is a very tough job. And why is that? Because as healthcare leaders, like all leaders, we have challenges, but add to that the challenges of leading in healthcare specifically. So it's a lot of challenges that we face. The needs of the patient, their families, they keep on changing and they're very diverse. Expectations from us, from our team, are very high and they continue to increase. There's a lot of pressure, a lot of stress, a lot of anxiety. And then add to that, the systems that we work in or within, the policies we have to follow, and the costs that we need to constantly manage. So that's a lot of pressure on us as healthcare professionals and more pressure on us as healthcare leaders. Because healthcare is demanding. Healthcare systems are very complex. So to function efficiently, all staff, clinical and non-clinical, need to be comfortable when they work within and with the healthcare system. And that's all for the benefit of the patients and their families. And now we always put families with the patients because we don't have any more, or we don't speak anymore of patients only. It's always patients and their families. So the group is bigger now and the needs are more. And we need to be there, not only for the patient, but the family. And the family could be 1, 2, or 10. So that imposes a lot of pressure on us as healthcare professionals. So as a healthcare leader, it is my responsibility to carve this comfortable environment, to ensure that the work environment is comfortable and the environment as large is comfortable for the patient and their family. The clinical leadership has a lot of impact on the patients, their families, and on staff. Efficient clinical leaders, they ensure that there's a comfortable work environment, and that affects staff performance. It's phenomenal. The care is safer. Patients' experience, families' experience, staff experience is greater and better. Hence, the care outcomes are optimal. On the contrary, when the clinical leader is less effective, then there's a lot of stress, and that would impact staff morale. We would have high rates of incidents, patients' experience would be poorer, and staff would be more stressed and pressured, a lot of burnout, and big rise in turnover. And ultimately, that would impact care outcomes. When the work environment is comfortable, it's a good thing because staff feel comfortable, patients feel comfortable, the productivity is higher, staff are more engaged, they're more motivated, they're happy, it's their happy place. On the contrary, when the work environment is not comfortable, when there is a toxic work environment, staff are demotivated, excuse me, staff are demotivated, drained, exhausted, depleted. This is very discouraging and very depressing. And when staff are not comfortable and they're stressed and they're depressed and discouraged, that reflects on the experience of the patient and the family. So research proves the fact that a toxic work environment can only root when there is a fertile environment for toxicity. And how does that happen? When the leaders tolerate the toxic behavior. And more than that, when they ignore it or try to shove it under the carpet, pretend that it's not there, then the problems become predominant and damaging. So toxic co-workers who try to transform the comfortable work environment into a toxic work environment, the uncomfortable, stressful work environment, they basically create stress to everybody around them, not only staff, but patients, their families, and to us as healthcare leaders as well. So the whole work environment becomes infectious and unhealthy. But the good news is, it is amazing what we can do as nursing leaders to transform this negative energy and mend the dramatic flare of those toxic staff. As you can see, it is always important to have a process, and the process needs to be cautiously planned. Why that? Because when we have a perfectly planned or a cautiously planned, simple terms, a good planned process, then we're able to find those resolution opportunities. And here's what we do. We need to follow the process in the sense, and the process is very logical, we do it anyway, but we need to make sure that we do each and every part of this process. So we cover the whole thing. We don't leave anything hanging or pending or unaddressed. So we start by admitting that there is an issue, acknowledging that there is a problem, because when we acknowledge, we're admitting there's something, we need to fix it, and the sooner we do that, the better. So it doesn't take strong and deep roots. What we're after is treating the cause. We do not want to treat the symptoms. We need to understand where all of this is coming from, and we need to treat the cause. So we need to identify the bug, contain it, and successfully intervene. But before we intervene, we need to plan for the intervention. So I know I have a situation, I root caused it. Now I need to plan before I act. And why do I plan? Because I need to understand what the situation is and how I can handle each situation or each action. If I'm talking to the staff who are responsible, be it 1 or 10, I need to be prepared for whatever is expected and also be prepared for whatever is not expected. So I kind of need to do my homework before I call them in, put them in their room, talk to them. Sometimes we do it on one-on-one basis, and sometimes we need to bring the whole group if it's more than one. It depends. That judgment is something the healthcare leader needs to consider and take. Whilst addressing the situation and the involved people, don't forget to support them, because there's definitely a reason why they did that. And when we want to talk to them to root cause or dig deeper and find the reason why they're doing this, we need to be supportive so they feel comfortable talking to us. And with them together, we try to find a mutual resolution. We want their buy-in. We want them to be a part of constructing the solution, because if we don't, they won't comply. So we want them to be with us hand in hand so we can find a solution for this situation. Throughout this, we cannot forget to empower, and empowering by educating them, educating the group at large and educating that identified quote unquote toxic group as well. And this could happen in two ways: informal learning or organized educational sessions. And why that? Because the group who is being toxic or spreading this negative energy, they need to be educated and they need to know the impact of what they're doing. But at the same time, the group who is receiving this negativity, the other group who is working in this uncomfortable, toxic environment, need to understand that it's not okay to work in such an environment. It's not okay to be intimidated by the toxic co-workers. They need to understand that. And this is where education fits very well. And lastly, it is always good to anticipate and assume that we've addressed the situation and anticipate that the intervention we've done would generate desired outcomes. The happy ending cannot be presumed and cannot be confirmed. This is why, as a healthcare leader, I need to keep an eye, I need to observe, I need to follow up and intervene as need be. Because if I fall there, if I don't follow up, if I don't observe and I don't intervene, we go back to point zero, and we don't want that. The key takeaways. It is very important to acknowledge that there is a situation in order to address it. So we can limit this malignancy, because toxic work environments are malignant and infectious. So we want to limit this malignancy from growing and spreading. That's all for my session. And I welcome your comments, questions, and feedback.
Thank you, Dr. Aline, first for the wonderful presentation. It really gives us time also to reflect on our careers and the way we want to plan them to go, and even at our working environment, and how to be able to settle things. We all thrive to work and build careers, but we want to do that in a non-toxic environment where we can enjoy this path and move with it. So
Exactly.
yes, and I would like to welcome Dr. Aline again as a chair for this session, and welcome for any questions.
I think
Fasoon has. Yeah,
I think we-
Fasoon has.
Sorry,
Hi.
Dr. Aline. We have a question from
Yes.
Professor Fasoon.
Fasoon.
Yeah.
Yeah. Thank you, Aline, Dr. Aline, for your presentation. I am also working in leadership. I would like to know, your presentation was very good. Thank you very much about
Thank
it.
you.
I would like to know, during the COVID-19 process, which kind of experiences did you live in your country when you look as a perspective nursing leadership? Which kind of toxic nursing leadership reaction during the COVID-19? Give me some example from your country.
Okay. I might be able to give you some examples. However, I'm certain there are more. But in general, during the crisis, where there was a lot of need for nurses and there was a lot of pressure and stress and there was a lot of uncertainty and more than that, a lot of fear, healthcare professionals were practicing or working in an environment that was scary, that was infectious, really, as an infectious. So they go to work, they're scared to encounter patients and like be infected themselves with COVID. So that all impacted the level of pressure they're under and the stress they're under. And when staff are under stress, then they're short-tempered and they react and snap and say words that are not necessarily professional, and they impact other people as well. So you can imagine if that was the environment, what would happen. And given the shortage in nursing, and later on, given the nurses who were infected with COVID and had to isolate and be away from work, there was a lot of need for overtime. But the existing nurses were so worried to fill in those gaps because they just wanted to do their shifts and go home and try to secure their own safety, if I may. So yeah, there was a lot of tension, a lot of stress, a lot of snapping, and the healthcare leaders per se at that point were on a lot more pressure. If I don't want to say 100 times more, I can easily say 50 times more pressure, because they needed to orchestrate everything. They needed to orchestrate, make sure staff are there, schedules are done in a way to cover all shifts, but the surge of patients. So there was a lot of tension, a lot of pressure, and this was the main thing that made environments uncomfortable for healthcare professionals, healthcare leaders, and patients per se.
Thank you very much for your feedback.
My pleasure.
Dr. Aline, I would like to ask you a question. So working in a hospital practice, I always had this question in mind. So how much is clinical leadership being implicated in the daily activities of the hierarchy managements in the hospital setting per se, or healthcare institutions? So from your expertise across the globe, how much it's really implicated on the ground as being actionable?
It is very actionable, but then it also depends on the leader himself/herself. So the leaders themselves are the ones that need to be able to perform, right? Because we can easily slip away, and it's easier to slip away.
Yes.
Being an effective leader in healthcare needs a lot of skills, needs a lot of emotional intelligence, needs a lot of tactics, and needs a lot of practice, because we always face new situations and learn from them. As a healthcare leader, I need to be open to learning, and I need to acknowledge when I don't perform at my optimum level. And it's all right not to. Everybody has those slips, and that's fine. But if we keep on slipping, we never improve. But when we learn from those situations, day in, day out, and we work on improving ourselves, enhancing our approach, then we do better. But here, I have to mention that my secret recipe, if I may, for effective healthcare leadership. Effective healthcare leadership requires positive leadership, a positive approach. When we have, as healthcare leaders, a positive approach, it will be a bit tough on us in the beginning until we really blend into that approach. But when we do, it becomes very easy for us to lead, because we don't lead top down. We basically orchestrate. where everybody's in their position doing their role. Even the nurses are leaders because they are leaders in their own area, in their own role, in their own performances. So when we empower the team as the nurses and empower the managers, as in the nurse managers, supervisors, then as a healthcare leader, my role becomes to orchestrate and just be there to empower and support everybody else. Add to that positive leadership, being so positive and finding the positive in every situation and supporting my staff and empowering them, then the recipe is complete.
Thank you, Dr. Aline, so much. Thank you for sharing the secret recipe too. Thank you for the coaching session. I would consider it. So any more questions from the audience?